Good afternoon, everybody. Thanks very much indeed for joining us. We've just had the latest meeting of the Greater Manchester COVID-19 Emergency Committee, and obviously want to update you on our discussions. I'm joined today by Sir Richard Leese, who will provide a health update in a moment. Also by our Cycling and Walking Commissioner today, Chris Boardman, who will talk to the Build Back Better theme and how we begin to do that straight away on active travel. So I'll bring Sir Richard and Chris in a moment. Just to say that we started today's meeting with a moment's silence for Dr. Saad Al-Dubasi, a GP for 20 years in Bury, more recently working in Ramsbottom. Obviously, as a mark of respect to him and his service, but also our meeting today heard a call that all NHS and social care staff, all public service staff who've lost their lives in the course of this crisis be recognised at some point, and we will indeed be bringing forward proposals to do that. Turning to the overview, the picture is still difficult and is hard to say that it's in any way through the main crisis. The words used by our Chief Resilience Officer was that we're not certain yet that we've plateaued in terms of new cases, although, as I'm sure Sir Richard will come on to explain, the pressure is easing on intensive care, and certainly in terms of the number of patients with COVID-19 in hospital. Although, of course, care homes remain a major concern. The new system that we've introduced for care homes across Greater Manchester to provide much greater early warning has produced its first data for us today. Of the 504 care homes that are part of that system, there are 565 in total. So we have the vast majority of care homes in Greater Manchester on that system. Some 55 are reporting cases. That is up from 50 last week. So there is still a concern that there is a spread of infection in care homes. Overall, of the residents in care homes, the incidence of COVID-19 infection we think is around just under 7%. And again, that is a cause for concern. And we obviously are going to keep a very, very close watch indeed on those figures going forward. Richard, I'm sure, will provide a more detailed update. Just on PPE, I think this is the first week I can report a much improved picture with healthier supplies of PPE, not just across the NHS, but in out of hospital settings and social care too. Just a couple of trusts experiencing some difficulties, but we believe they can be managed through the mutual aid system. So a much better position to report to you there. Other developments since we last spoke, we have launched a bereavement service, which is now up and running, a Greater Manchester bereavement service to provide support for families in this difficult time. Turning, if I might, to economic matters, the team at the Greater Manchester Combined Authority have been making a case to central government for the small business support scheme administered by local authorities to be extended to reach those businesses who may pay business rates as part of their rent, but not necessarily have a business rates registration. So this could be businesses that work out of shared working space, or people who rent market stalls, or other forms of shared working. So we are pleased that the government has responded to that and has released funding to help businesses in that position. We are awaiting further guidance from the government, but we've agreed today that we will move quickly as a GM system, working with our 10 districts to provide that support to those businesses who desperately need it. So I'll leave it there for now. I'm going to now bring in Sir Richard to provide a fuller health update. Richard.
Thanks, Andy. I think I'll probably start with the debate about whether we plateaued and where we are on the plateau. If we look at the figures for this week on total number of cases and death in hospitals and compare them with the previous week, although there has been an increase in cases, that increase in cases is about 75 cases less than the increase in the previous week. And if we look at deaths in hospital, the increase in deaths in hospital, that's about half of what it was the previous week. So still not insignificant. There are 126, an increase in 126 new deaths in hospitals, but we would appear to be on the right side of the curve in that the rate of increase is now going down rather than going up. In terms of total number of identified cases, this is made more difficult because we are clearly now testing a lot more than we were, and it would have been the case a few weeks ago. There would have been lots and lots of cases that we didn't know about because they'd not been tested. Now we are more likely to know about them, and again that would suggest that the figures are going in the right direction rather than the wrong direction. Andy's already spoken about care homes. Clearly, care homes, we, right from the beginning, anybody discharged from hospital into a care home was tested before discharge. We started testing certainly for people living in care homes a couple of weeks before that's introduced as mandatory by government. So, and we've been providing PPE through mutual aid before that we got national supplies as well. So we have been giving priority to the care system, but at the same time we do want to understand properly what is going on in care homes. So we are going to spend some time analysing what's going on there and making sure that everything is being done to make sure that we look after and care for the people in those homes. If I look at hospitals, that if we look at the occupation of ICU beds compared to a week ago, it's down by about a third. So it's gone from 190 ICU beds occupied to 136. And similarly, there's been a reduction of over 100 in the total number of COVID cases in hospitals in non-ICU beds. At the same time, bed occupancy in hospitals has gone up slightly. It's still only just over 60%. But if you put those two things together, it does mean that we are getting at least a slow improvement in non-COVID cases who ought to be in hospital being in hospital. I think we've got about 5% increase. We need to do a lot more than that if we can. The publicity campaigns will continue to try and make sure people who should be contacting their doctor or 111 or going to A&E are doing so, and getting that message over is that we can do that in a way that does separate off non-COVID cases from COVID cases. Given what's happening in hospitals, it's fairly clear that all the capacity that's within the Nightingale will not be required for its additional purposes. Are currently looking at what that capacity will be used for. And I think there is a great deal of reluctance to lose the capacity because planning ahead to the winter coming, there is first of all the risk of spikes of COVID-19 cases over that period of time, and the risk that that would be coupled with other epidemics, particularly a flu epidemic. And we do need to make sure that we do have capacity in reserve for those eventualities. Looking ahead, I think talked last week about a little bit about contact tracing and mass testing. That as we start the return to normality, the combination of mass testing and contact tracing are going to be absolutely fundamental. It does need to be a national system, clearly, that who you have contacts with does not necessarily respect local authority boundaries or city region boundaries, and we do need to have coverage that goes beyond that. But at the same time, anything that's IT or app based is going to miss a lot of people out. We know from the work we've been doing with vulnerable people in Greater Manchester, there are a lot of people who don't even have a landline, never mind a smartphone. An app is not going to reach those people. It means that we do need a local element to contact tracing and mass testing. It means we need boots on the grounds as well. Not everything can be done through technology. There needs to be a physical element to this. And clearly we have expertise in environmental health, in public health. People already do contact tracing as part of their everyday jobs. We need to train more people up to do that. We will need a workforce here. But what we're really intent on doing is making sure, as far as we can, that when a national system is introduced, that the local requirements to make it a comprehensive system are built in, rather than something that we have to put in as either to fill holes or as add-ons to that. There have been discussions between the officers here in both health and local authorities with Public Health England. I'm assured that that has gone up to the Chief Executive of NHS England, but we're determined to make sure that we don't make mistakes we made previously with testing, with PPE, with the volunteer programme, and Andy and myself are intending to write to the Secretary of State for Health to really lay out how we think we can best contribute to that national effort in terms of addressing those particular issues. It's still the case that on the current testing, we don't have all the data available to us about who is being tested or why they are being tested. And again, if we're going to have an effective mass testing system, we really need to know that at a local level, so we can make sure that everybody who should be tested can be tested. That's the last thing I'll say about that, is that we also expect testing to go beyond people who are demonstrating symptoms or are known to be in contact with somebody demonstrating symptoms. In some areas, for example, health and care professionals, we are proposing that there ought to be routine and regular testing of people, because again, we think that is the route by which we will be able to return back to the new normal as quickly as possible. I'll end there, Andy.
Thanks very much indeed, Richard. I'm sure we'll pick up some of those points in questions. I'll turn now to our Cycling and Walking Commissioner, Chris Boardman. We have seen an increase in cycling and walking in GM, as we have in other parts of the country. And on a call with the Prime Minister last week, I and other mayors were encouraged to act quickly to see if we could take that increase and obviously create more space for people to cycle and to walk, but at the same time keeping them safe with regard to social distancing. So today Greater Manchester responds to that call. We've done some really great work through Chris with our 10 districts, and Chris wanted to update you all on that, and I'll hand over to him. Chris.
Thank you, Andy. Good afternoon, everybody. So I think a bit of background really, that we knew going into this that a third of Greater Manchester households don't have access to a car, and our average journey length is less than 5 kilometres. So it shouldn't have come as a surprise to us really that people turn to cycling and walking to make essential journeys, particularly key workers who do tend to be lower paid. We've got a lot of hospital cleaners. We have a lot of people who were relying heavily on public transport and then couldn't. As a result of that, all modes, as we know, have dropped. We've seen 60% plus drop in car use, around about 90% for public transport. However, cycling has seen an increase that peaked at 22% on pre-COVID levels, and that obviously takes into account that the majority of people can't make journeys. So a lot of people relied heavily on what has become a robust form of transport. So because of that, leaders, councillors and various members of the public were contacting us to see what we would do right now during the crisis to make sure that people could continue to travel like that whilst maintaining or adhering to the distancing guidelines, both now and during recovery as we start to turn things back on. So we've looked at that, and I think the boroughs, it has to be said that each of Manchester's boroughs have worked very hard in the last 2 weeks to look at what they could do, where they need to do it, and plans were pulled together very quickly, and I have to commend them for their speed in acting on this. As a result, we've set aside a £5 million fund for them to call upon to put in temporary measures, and they will consist of things like footway extensions, one-way streets, removing through traffic in some areas, adding extra cycle lanes, and removing street clutter, such as barriers that are actually seeing clusters of people, which is obviously something we don't want at the moment. And of course, we have the B network, which we were already planning to implement across Greater Manchester. This is where people told us they wanted to be, and several of the boroughs are going to try and fast track some of that work and probably put it further up the agenda in terms of which bits of it are a priority for them. Excuse me. I think we're all very much in agreement that this change in the way people travel is something that we want to take from this, and it will be part of building back better. It's something that we wanted to see before. Now people have shown that if you give them an environment with car levels at 1955 levels, then they've chosen to do so, and it's something we want to make sure that they can continue to do that. So this is one of the things that we put in place. And I think that's it for me, Andy. Really, probably better to go to questions from this point. You're on mute, Andy.
Thanks, Chris. Thanks for everything. You nearly missed your compliment there, so it's a good job you got the microphone on. I was just saying thanks for everything that you've done, your dedication to this this work in GM, and obviously we're in a really good position to make progress, and this announcement today really represents that. It is building back better. So thank you to you. And Ross, I think, were you going to moderate the questions for us?
Yes, I am. I'm going to take first a question from Jennifer Williams at the MEN 214. It was the first question that was submitted on the original portal, so I think it's only fair. It's a question for you, Andy. Could we get your reaction to what Boris Johnson has said at PMQs, in which he said that government had hoped to start easing the lockdown from Monday? Are the numbers in Greater Manchester falling sufficiently that he feels it can be done safely? Thanks.
Well, I think, as Sir Richard was saying, there are some encouraging signs within all of the indicators that we get presented with every week. But Jen, I'd have to go back to the comment from the Chief Resilience Officer, which was that we haven't yet got clarity that the trends are discernible, that there's a clear picture, and that we are beyond the plateau and coming down the other side. So, you know, that's what we were told today, and so that, I think, leads us all to a cautious, safety-led approach to this. And you know, if there is to be a change announced on Sunday, and we don't know yet, so we'll obviously have to see what that change is. We would need reassurance, I think, that the trend within Greater Manchester and indeed the rest of the Northwest was showing sufficient progress that was not a premature decision to relax those restrictions. I think we'd also need some reassurance that if it's being announced on Sunday to come in on Monday, that we won't see a repeat of some of the confusion we had when we went into lockdown, when some organisations didn't know whether they could open or not. Of course, if there is to be a call on public transport next week, that needs to be planned as well. So there are some practical issues here. But I suppose the main thing that we would want to emphasise is, you know, that the picture we've had today doesn't show a clear and decisive trend in a particular direction. And because of that, we would ask for a cautious approach. And from what I've heard so far, some of the rumours I'm picking up, I would express a concern that any significant release from lockdown would be premature as far as I'm concerned.
Thanks very much. I'm going to go to a question, two questions for Chris Boardman. The first is from Harry Sherwood at the Observer at 2:13. The question is, the number of people buying and using bikes has increased since the start of the coronavirus crisis. Do you expect that to rise in the coming weeks if lockdown restrictions are eased? How can transport authorities encourage this? And do you see this rare positive this as a rare positive outcome from the pandemic. And just in addition to that, Carlton Reid at Forbes has said that the figures we've released mentions a share for cycling and walking is 33%. What is the share for cycling alone?
Okay, thank you for those. So I'll take the first one first. Working in the industry, I can tell you the demand for bikes is phenomenal at the moment. And when you consider the ways to access the market is very difficult at the moment, and the industry is actually having a hard time keeping up. I think that's a great problem to have at the moment. In terms of provision, we are already in the throes of pulling together a bike hire scheme for all of Greater Manchester. TFGM is working hard on that at the moment. In the very short term, TFGM has got 472, I think is the number, of bikes available that we bought for use by key workers, and they're out deployed with the NHS now. And I think they're the main measures that we're taking to make sure there is provision. If we have control of a bike hire scheme, then of course we can choose how we deploy that to allow people to access work or different levels of support that we could give people. And I think that's something that's being looked at now. And Carlton Reid's question, the mode share at the moment is about 5% for bikes, so it's 2.5 times up on what it was before. And you have to bear in mind as well that the reduced amount of journeys at the moment. But overall, bike use is up 22% on last year, which is quite something.
Thanks, Chris. It's a question for Andy, from Andy Smith at Wish FM and Tower FM. It's been reported that the Chancellor is going to lower the furlough wage subsidy to 60% from July. What are your thoughts on this? Could it force people in Greater Manchester into poverty?
Yes, it could. And there was concern expressed about potential changes to the furlough scheme. And at our meeting today, Councillor Leese Wilson, the new portfolio lead on economy and business, was making this very point that abrupt changes to furlough could have really severe implications, both in terms of business failure, but obviously, as you say, forcing people into hardship. And if there's a cliff edge with the furlough scheme, it could be particularly the hospitality sector that falls off the edge of that cliff and really suffers serious damage. So our call from Greater Manchester is for a flexible approach to furlough. If we recognise that there will be some sectors that will struggle to bring back employees in the same numbers as others, then of course they're going to need to rely on support for longer, or they may need to bring people in for some days, but not all of the days of the week. So the call from Greater Manchester is to avert a cliff edge approach to this. Give businesses the ability to plan. The more we support businesses now and help them survive now, the more of an economy we will have left to recover later in the year. So that's very much the call coming from Greater Manchester, a flexible approach to furlough.
Thanks, Andy. I'm going to go to two questions about Metrolink. The first is from Jen Williams at 2:14. Has the mothballing of Metrolink now been ruled out? Do you know yet how the network will operate in the absence of PHE guidance on face masks or the full bailout from government you'd been after? And the question just below that one's Adam Clark, also on Metrolink. A number of key workers in Bury and Rochdale require the Metrolink to make their daily commute. Seen reports from Metrolink they will require more support for the service to be able to continue. Do you have any further update on government funding?
So thanks, Jen. Ross, the second part of Jen's question dropped out. Oh, it was the PHE.
That's the one, yeah. So it's Jen Williams at 2:14 about mothballing, and then Adam Clark from Roch Valley Radio just below that. Okay,
thanks, Jen. Mothballing is off the agenda for now, although not completely, is the way I could describe it. So last week we received 73% of the costs that Greater Manchester's system is incurring in this particular period. So it was not full cost recovery, and this is a package that is to last until June. So there is a shortfall that Greater Manchester has to find, and the committee was updated today, we can potentially, well, we can find that level of money from reserves, but we couldn't find that on an ongoing basis. So together with other mayors in authorities in the urban transport group, we've written today to the transport secretary to say that, you know, if we are going to be running public transport with much lower levels of occupancy, then we're going to need a proper funding deal that carries us right through this period and throughout the rest of the year. And that's where, if we don't get that deal, mothballing may, I'm afraid, have to come back on the table. And that's what the chief executive told us today, you know, that he couldn't sign off the losses going forward if the government was to continue with its current approach. So we welcome the funding that was provided last week, but we do ask the question, where are we meant to find the rest from? We're trying to maintain a service here for essential workers, but it's very difficult when all of our costs are not being covered. And I'm not alone in making that case. It's one felt by all of the mayors within the urban transport group, and it's why we've written today. Of course, there is a related issue here about guidance from Public Health England. If I'm hearing that the rumours are that there's going to be a release from lockdown, that will have implications for public transport, or a modest release, let's say. And we need to know what that guidance is so that we obviously can run a safe public transport system, whether that will be social distancing on public transport or a recommendation that people wear masks or face coverings. We need to know which it is so that we can plan accordingly and therefore run services as a result. Adam's question. Well, I think I've answered that one, Ross, haven't I? In the question, we got 3/4 of our costs met, to be honest, in the government's package, Adam. But as I say, this is not a deal that lasts until the end of the year, so the issue hasn't gone away. And mothballing, I'm afraid, won't go away until we've got clarity over that longer term picture.
Thank you. I'm going to take a question from Andy Bounds, I think probably for Richard. He's saying he may have misheard. Can you confirm the level of infections in care home, please? Is it 7% of all residents or 7% in the 55 care homes with outbreaks, and how many people is that?
I can answer half the question, Andy, which is actually the precise figure is 6.8%, but it's 6.8% of all residents in the 504 care homes that we have data for. And this is the first week that we've had a comprehensive social care dashboard that goes across Greater Manchester. And I've only got a summary of it at the moment, so I can tell you how many spare beds we've got in care homes, but I can't tell you how many occupants, but we will by next week.
Thanks, Richard. I'm going to go to a question from Charlotte Cox, and there's an initial question, there's a clarification underneath, so I'll just take it together. You mentioned that all patients from the beginning were tested before being released to care homes. However, we've heard from some care home staff this has not always been the case, with examples of them finding out residents' positive test only after their admission. What do you think's happened there? And the clarification is patients were tested, but their positive results were not shared with care homes before the patient came into their care.
Well, I'd be surprised if that is the case, and clearly it's very difficult to comment on. Some care home staff have said clearly, if we had those cases reported to us, we'd want to investigate and understand what has happened. But I can't say without knowing what the details of those cases are. And clearly we were testing the patients. I'd be fairly certain that those results were passed on to the care homes. Whether that then gets through all of the system, I really can't comment on without looking at the individual cases.
Thanks, Richard. I'm going to go to a question for Andy from Nigel Barlow, and then there's a number of questions that will be for Chris on cycling. But the one for Andy from Nigel Barlow, you've consistently promised and kept your word that you would not criticise the government's general approach to the crisis. However, as your party leader said earlier today in the House of Commons, isn't it time to say that the government strategy has not worked up to now? And secondly, given its performance to date, how much faith do you have in whatever strategy that comes next? And, you know, as we move to the next stage, we'll begin to get the country back to work. That's Nigel Barlow at 2:14.
Well, thanks, Nigel. I mean, the approach I've taken all along is that the inquest will come after. What we've all got to try and do in this moment is work together without necessarily falling out or finger pointing, so that we can make the response as good as we can make it. And that's what we've tried to do in Greater Manchester, and where, you know, we felt there were some deficiencies in the national response. We've tried to work through them and work around them to put in place fixes. So, you know, the focus in this period has been very much on dealing with the crisis. As somebody who's dealt with these issues in government before, you know, I know that can't be a perfect response to these issues, but at the same time, where things haven't been going right, you do want to see the government face up to those things and then make changes. And as Sir Richard was saying before, you know, we have some concerns that a pattern is being repeated, that systems are being put in at a national level without sufficient local input, and they are then not as good as they should be once they hit the ground in our areas. So, you know, we are asking the government to hear that local input, and that's why Sir Richard and I are writing to the Health Secretary today. There does need to be, of course, a wider consideration of what the government got right, what they didn't get right. There are questions about not just what they've done in this moment, but were they updating the stockpile, the national stockpile that was in place in the years running up to this moment. So, you know, there are big questions, and there will be a time when they need to be asked. But I still think it's right for somebody in my position, as opposed to the leader of the opposition who's got to hold the government to account in the House of Commons. You know, I am part of helping to make this system work in this moment. And I think while I do challenge the government and I do make pointed criticisms at times, I've tried to do it within a constructive spirit. And I think preserving a degree of national unity around this is the right way to go, while at the same time making our views clear and known where we think change is needed.
Thanks, Andy. I'm going to go to a series of questions on cycling for Chris. The first one is from Judith Moritz at the BBC at 2:37. Can you give us some more detail about the major roads and routes we may see changes on as a result of the 5 million being given to promote cycling and walking? Also, many cycle routes, for example, along the Mersey in South Manchester, have been very congested with walkers and cyclists jockeying for space. How do you deal with this whilst social distancing must continue?
Thank you for those. Well, I think probably best to clarify, first of all, that there'll be a much more detailed press release that goes out at 3 o'clock, and that does give much more detail on what each of the boroughs are intending to do. And of course, some of them are very much underway. We know that in Manchester, Deansgate, parts of Deansgate have been closed to traffic, which is a welcome proactive move. And there's a lot more of the boroughs in Manchester considering similar things. So it's a variety of different things. Certainly riding bikes in particular, it almost helps to distance yourself straight away, because your effect is going to be focused on pavements, making them wider. I think the study that I last saw in London was 2/3 of pavements did not give enough room for. So a lot of measures, I think, will be focused on that. I think we're intending to contact Grant Shapps in the next few days, asking for assistance, and not necessarily financial. I think primarily there's a couple of things that they could do. Messaging at the moment is really important to actually show that this isn't about cycling and walking. This is about allowing people to move around and protect the NHS short term and long term. But also in the background, we have a study at the moment going on to be able to implement zebras side road zebras, which is what the rest of Europe does to enable people to walk more safely across the thousands of side roads that people negotiate in Greater Manchester. Well, we're halfway through that study, and it showed 94% of people have said, we understand what this mark means, but we haven't quite got to the point yet of being able to put trial versions on the road to allow people to walk in safety. And so grant chaps could, for example, allow us to go and do that and start those trials now. The evidence is there and the districts would like to do it. So there's an awful lot of detail that will come this afternoon in the press release at 3. There's a lot of measures that we can do. It is very much district led. They decide what's needed in their areas. They may want to reduce clustering around transport hubs, for example. And there was also some asked about how do we make bikes more accessible. And I mentioned the work ongoing at the moment on the bike hire scheme, and that we've got 472 bikes already out with the NHS workers that was organised by Transport for Greater Manchester. We could, for example, look at things like extending that bike loan scheme as well. So emergency measures are always exactly that. There's a lot of thinking that you have to do very quickly, and I think we're moving as quickly as we can.
Thanks, Chris. Just see you cut out a little bit during that. So if that happens again, I might just ask you to just go back and go over what you've said.
Okay.
There's 2 questions, one from Laura Pratt and one from Laura Laker. And I think the first one is introducing things like more cycle lanes, one-way streets, etc. How easy will that be to put in place? And do you think, and do you know when we could see this in action? And also from Laura Laker, the press release mentions side road zebra crossings. What difference would it make now and in the recovery if government were to support their use as an emergency measure? If you've anything to add to what you've just said, and I think Andy may want to come in on this once you're finished as well.
Yeah, well, the side road zebras is a tool that we very much love to be using right now, and it is within the gift, we believe, of the Transport Secretary to give us the confidence to go ahead and do that. There is precedent for it, but we'll be taking that up with them probably in the next few days. And as far as what people can do, well, there's a lot of different measures. It isn't about bike lanes necessarily. It can be moving forward plans for filtered neighbourhoods, reducing speeds across an area. It's been done already around the country. And there's a lot of this already well within the powers of the districts with temporary measures. And DFT have actually added to those measures with an emergency order, strengthening their ability to do that for specifically this reason, so they can create safe space. So I think we're reasonably well armed to get on and protect the space and allow people to continue to physically distance while travelling on foot or by bike.
Thanks very much, Chris. There's a few more cycling ones later on, so I'll bring you back in on them. But I'm going to go to a question from Laura Pratt for Andy. There are worries that London might be past the peak, but we aren't. Do you worry that if the lockdown restrictions are lifted at the end of the week, there could be a second peak or more pressure on the NHS?
Thanks, Laura. Yes, I do worry about that. I think I've said all along on these calls that we feel we're lagging 2 weeks behind London. So what I would say today, and I hope the government will address this directly, is that they need to provide direct reassurance that they've looked at the cases across the Northwest, in all of the different parts of the Northwest, because just talking about a region may not actually give you the full picture of what's happening in the different city regions. That they've looked at that data and they are confident that it's safe to do whatever they're about to do. So I don't know what they're proposing at this stage, but I have to say I do have a concern that if there is any loosening, it might be premature in the northwest of England, and I will want to be reassured by the government that it isn't the London picture that is driving the national picture. I think it's right to move as one country, but I've never called actually for an early release from lockdown. I've only called for a safety-led approach or a standards-led approach when it comes to releasing from lockdown. And the test I will be setting the government over the coming days is they need to prove to us that it is safe to implement these measures now, as safe in the northwest of England as it is in London or the southeast. And we will need to be very much reassured on that point. Given, as I say, that we don't feel the trends are as clear yet in the northwest as they are in other parts of the country, and I think we all saw obviously the northwest go to sadly the top of the national table when it comes to the graphs at the Downing Street press conference. I mentioned care homes, and I just want to clarify actually, because I gave figures, and I just want everyone to know what those figures are. I think they were given out before Richard joined the committee meeting this morning. The 55 is actually 55%. So that relates to the number of care homes in Greater Manchester that are reporting cases. So there are 504 that are part of our system, and that 55% relates to that 504, but there are 565 in total. So just so people can kind of have those figures directly, that's 55%, probably of 565 care homes reporting a problem, and that is up from 50% last week. So there is still a concern that the virus is spreading in care homes. And again, that's another consideration for the government as they consider what they announce at the weekend. And I just would stress again, please, it's got to be a caution first, safety first approach.
Thanks, Andy. We've got a question from Hannah Miller, and just to say, given we started later, I was going to continue on with the questions for another sort of 10-15 minutes after 2 o'clock. This question is for Richard in the first instance, from Hannah Miller at Granada. We've heard reports elsewhere of people being turned away from mental health support while this has been going on. Are you aware of that happening at all in Greater Manchester? Were people being turned away from the NHS mental health support, and if so, are there now appointments available? Your microphone's still on mute.
If anything, it's exactly the opposite in Greater Manchester. Again, at the emergency committee this morning, we had a fairly comprehensive briefing from mental health services in Greater Manchester, who quite explicitly say that they are stepping up their services for people with mental health needs, for learning disabilities and autism, and they are trying to increase, they have increased the number of ways that people can contact mental health services, both for those people who are already known to them, but also for an increasing number who are seeking support who have not been previously known to them. So that's what's happening. People aren't being turned away. Services are being stepped up. New ways of people being able to contact the services are being put in place.
Thanks, Richard. It's a question for Chris from Lyle Tweed at the Bolton News. He's asking, could anything be put in place to make buying bikes more affordable for workers post-lockdown, as many have relied on cheaper public transport before the lockdown, especially as work starts to improve the cycling networks in Bolton and Salford?
Thank you. Well, I think there's several points there. I mean, I've noticed that in the industry, there's a lot of people accessing, just want to get out and give it a go. You can get bikes for £60, a new bike for £60 at the moment. So it's a reasonably accessible form of transport. I've mentioned that the bike hire scheme that we're already putting in place and measures that we could consider there to allow more people to access them to gain employment. We've also got our scheme at the moment, as I mentioned, for the NHS that we could choose to extend. But I think on a much larger scale, there's already a cycle to work scheme that's open to employees, where they effectively get a bike for half price by removing the tax, and it's also taken directly out of a wage back a little bit each month. And so that's been very, very popular, been in place for several months. I think the government could extend that to cover a much wider group. I don't think it actually applies to self-employed people at the moment, and that's something that the government could do right now without cost to the public purse, or certainly not significant cost, that might make it easier to access bikes.
Thanks, Chris. It's a question for Andy from Helen Carter at the MEN. How do you think working from home will change once lockdown is eased? And how do you think austerity and universal basic income and corporate pay will be affected going forward?
So on home working, Helen, I mean, clearly there could be a potential rise in the number of people working from home. As I indicated to Jen earlier, the numbers of people travelling on trams and buses in the morning peak is going to have to be much lower for a considerable period of time. So I'm already talking to the Greater Manchester Chamber of Commerce about how we manage that. And you can manage it maybe by giving people a staggered start and end time to the working day, but you could also manage it by asking more people to work from home. And of course, that might be better for them. And that's another way that you might build back better, that you give people a more flexible working arrangement that works for them. It does mean you need good digital infrastructure everywhere. It's why we're calling on the government to help us expand our full fibre programme. Digital infrastructure sometimes isn't as good in, let's say, the more deprived communities, and it's really important that everyone has the chance to work from home if they can. We've had some innovation during this crisis with Greater Manchester Police 101 call handlers working from home. That's a benefit that the new computer system has brought, and I think that's certainly improved standards as well there. So, home working I think will increase. I hope it's something that should be offered to as many people as possible, but we are absolutely going to have a conversation with particularly companies with large presences in the city centre about how we manage transport issues and office occupancy going forward. How will issues around living standards, austerity, and you mentioned universal basic income, how will they change? Well, we have made the call about Build Back Better, and that very much relates to living standards for some of those essential workers who've been out there keeping the country running in recent weeks. And I can't be the only person who kind of sometimes feels that it's wrong that people in higher pay positions are at home having video conferences when the most low paid people in society, often on very insecure contracts, are out there keeping things running. I think in recent times we have overvalued work at the top and undervalued work at the bottom, and I hope there will be a reassessment of all of this as we move forward. I think another period of austerity would be devastating, not just for people but for the economy as a whole. I don't think we could take that. Certainly council finances couldn't take that where we are right now. And you mentioned universal basic income. I mean, I think that is an idea now that needs to be seriously considered. Because if you pay a real living wage to people, I've had supermarket staff in Leese say to me, well, we wouldn't see any benefit because we'd just lose money in universal credit. So it's giving us with one hand and we lose it with another. And it's whether or not the time has come to review that basic floor so that all people have a decent income to live on, and that might require reform to the tax and benefit system as well. So, I do think the country needs to have a serious debate about these things going forward. All people, in my view, should be paid enough at work so that they have a decent amount to live on. And if that is true anywhere, then it's got to be true of the care system. 58% of care workers in England not paid a real living wage, many of them women. That cannot be right. If you are in an essential role like that, you need to be paid enough so that you can manage things at home and be there every day to support people who need your care. So I hope we're going into a reassessment of these things, and that's what the Build Back Better campaign is very much about.
Thanks, Andy. I'm going to take two questions for Chris, and then we'll go to Charlotte Cox for the final question. Chris, the first question is from Helen Pidd at The Guardian. She's asking when the bike hire scheme is launching, and is there a way for members of the public to suggest hotspots where temporary measures can be introduced to help people walk and cycle safely during the lockdown? And Adam Clark at Roch Valley Radio asks, as a former sports pro when you see the return of sport coming, there's a lot of reports the Premier League is looking to play behind closed doors. Do you see that being a feasible option, or do you think the season should be brought to a close like some leagues have already been brought?
Well, I'm not sure I'm qualified to answer the football question, that's for sure. So I might leave that one to Andy. Bike hire wise, yeah, I think it's fair to say that scheme has taken a lot longer to bring to fruition than I'd have liked. It is a very, very complex beast because it isn't just bikes, it requires places to put those bikes on the streets and frequently as well to make it a viable transport option. It is one of the schemes that's really being developed at the moment. We are looking at how, I mentioned at the start, we can fast track some schemes to actually really get some stuff down that would benefit us during the recovery phase. If the leaders and the boroughs wanted to, we could make that one of the schemes that we prioritise, but it has to be their decision that's going on their streets. I would say that it goes hand in hand with the recovery of public transport as well. It's a very seasonal thing, so we couldn't, for example, launch it in the winter because I don't think that would be viable. So we've got to hit the seasons, and I think it's likely to be next spring at best now to do that. So we're working on it, and I think if there's a will to do it, we could move it forward, move it up the pecking order of projects that we prioritise. There was also another question there about pedestrianisation when I mentioned the work that Sir Richard's been doing in Manchester, and that was a welcome thing. Whether that expands, certainly in Manchester, that's a question for Manchester City Council, not for me. So I think I will hand over to Richard for that one. But it is one of the measures being considered by the districts, and that press release will expand a little bit more on that, which actually should be going out round about now.
Thanks. I think that's a question from Charlotte Cox in the MEN, which has said, are there any more firm plans in place to make use of these traffic regulations as you have on Deansgate to pedestrianise the streets across GM? Do you think temporary pedestrianised areas already in place will be extended beyond lockdown and become a permanent fixture? I'll go to Richard first, and then Andy may want to come in on that one.
Well, clearly I can only talk about a small geographical part of GM, but the Deansgate proposals are an early one, not least because this is something we've had in the pipeline for some time, so bringing it forward is relatively straightforward. But we have identified other locations, and we are particularly looking at pedestrian improvements, because actually to get our economy going, we need to be able to create space for large numbers of pedestrians to move around, and we're looking at the real blockage areas. Examples of where we will look at is, for example, London Road, Piccadilly, coming up from Piccadilly Station into Piccadilly Gardens into the city centre. Although it's a relatively wide pavement, at times we've got bus stops and other things there that make it quite difficult. So there are areas like that where we try to increase the pedestrian space. Similarly on Oxford Road, Princess Street, where very high pedestrian footfall normally, quite narrow pavements where we want to increase that. But we don't want to do things on a temporary basis. Actually, we want to do it on a permanent basis. So our intention, as far as possible, is to make this stuff as soon as possible permanent rather than temporary. One of the other things that Chris did talked about is what can be done at a local neighbourhood level in residential streets and so on, which again, we're very interested in that, but also clear that needs to be bottom up. It needs to come from communities rather than the council telling people what they ought to be doing there. But we would very much welcome communities coming to us with proposals for their areas.
Thanks, Richard. I'll bring in Andy. I don't know if you wanted to comment on the pedestrianisation, the football question, or if you had any final comments before we finish.
A lot I could say there on all of that, Ross, but I'll just follow up on what Richard said there about the bottom-up nature of this. Of course, that's got to be right. You know, it should come from communities first, through councils, and then to us. You know, it's not for me or for Chris actually to dictate to anybody about what should happen in their community, but it is our role to facilitate where there is a will to do something, and that's what came through to us in the meetings that Chris and I had with leaders over the last couple of weeks. You know, there's two things behind this, I think, at the moment. Number one, there is, as Richard was just indicating, a basic safety issue here. There are more people out running, walking, cycling, and there are more people having to go into the road because they're trying to keep social distance while they're doing those activities, and you know, sometimes that takes them into the road space. And so there is a public safety imperative here. So that's the first thing, and we need to do something about that, and we have responded to that with the schemes we're announcing today. But there's a second point, which is this is a moment to see if we can bring some culture change. I think one of the positives of the time we've been living through is people seem to have taken the instructions from the Prime Minister to heart, that not just that they could do one bit of exercise a day, that they should do. And that's certainly how it's almost been interpreted, and people are doing that in ever greater numbers, which is great to see. So the issue is, can we take this moment, make some real changes in communities, and capture that culture change as a result? So I've said to Chris that, you know, we can bring forward up to £5 million of the Mayor's Challenge Fund to facilitate these schemes that districts are asking for. But you would hope that some of them, as Richard was indicating, might turn into permanent schemes. On football, I think I said something on this yesterday, so I won't say a great deal more, other than I am a purist when it comes to football matters, and I am not sure how playing some games behind closed doors when the same fixtures were played to packed houses at home grounds earlier in the season means you've got a season that has integrity. It feels to me that is lost. And I'd also say is, you know, if social distancing is to be a factor, I'm not sure how you manage social distancing as part of a football match, although I have certainly noticed that Everton's defence on occasions have managed pretty good social distancing given the quality of their marking, but I'm not sure that was intentional, and I'm not sure I would recommend it either. But it feels to me, again, you know, that we mustn't get whipped up into a kind of situation here where we're kind of talking ourselves into an early release and talking ourselves into bringing sport back more quickly than we should. It's got to be people's health and safety at the forefront of this argument, and you know, we've got to be guided, as people have always said, by the science, and you know, that's why I say again to the government, you know, any changes that are coming soon need to be able to be kind of shown that they are not going to put the health of anybody in Greater Manchester at risk.